One of the things we understand about the urgent care world is that there tends to be a lot of repeat customers or repeat clinical scenarios. And nobody minds spending a few minutes to do a chart on a complicated chest pain or a complicated headache, but nobody wants to spend 2 minutes to document a typical ankle sprain. So we have tried to come up with tools to allow you to document simple, repetitive clinical scenarios very, very quickly. So that efficient and safe use of macros is really one of the key things that we think will help you be more efficient so you can spend more time with patients. So for instance, if I'm going to go see this ankle sprain and I walk out of the room and I know that this is a typical right ankle sprain, rather than starting a blank chart, I have previously saved a macro that tells me what a typical ankle sprain seems like. So if I start here, rather than choosing a blank chart, I want to choose a right ankle sprain chart. And again, this chart is customized to me. I saved it. It's very, very simple to use. And it says things like that are very typical for an ankle sprain. So the patient twisted their right ankle while they were, and I can type in here, playing basketball. And I know that ankle sprains tend to be sudden, they tend to be aching, they're severe, they get worse with palpation and with movement. Again, I've already filled those details out. There's still plenty of room for me to talk about the ways that this case is different from the typical ankle sprain, but all of the basic things are filled out. Review of systems is already filled out as if this is a typical ankle sprain. Past medical history, again, this is very specific to the patient, so I need to either fill this out or import this from the nurse's notes. For the physical exam, this has been saved as a typical right ankle sprain physical exam, where it says the classic risk management things that you want to say for ankle sprains. But again, I can document this without typing. When I get down to the medical decision making, again, I have this filled out as if this is a basic ankle sprain, and I can choose whether or not this is a typical ankle sprain that required x-rays in this case, or a typical ankle sprain that didn't require x-rays. But again, that documentation is done by simple editing rather than creating from nothing. And I've already got the final diagnosis filled out as if this is a sprain of the right ankle, because it is. And then simply as just to start the chart, change a few things that are specific about this patient, and save the chart. And so in our time studies, we think you can fill out a basic right ankle sprain chart once you've created the macro in about 14 to 15 seconds. That's the kind of thing that allows you more and more time to take care of patients.